Hi. Okay, so today we're going to be talking about an anxiety disorder, panic disorder, or whatever else you'd like to call it. Um, the most affluent mental ailment category in the United States is anxiety disorders, and they affect 40 million adults in the United States, which is 18% of the whole population. And there are many signs of a panic attack, such as wobbly knees or jelly legs, or just overall shakiness or trembling, a rapid heartbeat, shallow breath or quick, unfulfilling breaths, so you just can't get a full gulp of air, unbearable feeling of dread. When you just know something bad is going to happen and it feels terrible, like just something really, really bad, but you don't know what. Or you might know what, but it's still a little hazy on what exactly it is. There could also be racing thoughts or lack of focus, and chills or heat flashes, chest pain, feelings of fainting, nausea, intense worry, and that goes along with the dread of something happening. Um, Causes in your brain chemically for a panic attack would be too much serotonin, that speeds up everything, thyroid problem, or amygdala malfunctioning. Um, You may also avoid being in situations similar to the kind that brought on your previous panic attack before. Peaks within approximately 10 to 20 minutes, so don't fret too much because it should be over relatively quickly, but it will feel like a while. It can last for up to an hour in some cases, but it won't always be the same consistency. It may have its peak and then just kind of be okay, but still not quite right. And um, you may have anxiety surrounding the anticipation of having another attack. So, with that comes avoidance. Some limited symptom attacks may include 3 or less of these symptoms. So, they're not as radical, but they're still going to be pretty noticeable. Um, this specific disorder affects twice as many women as it does affect men. And panic attacks can occur in other anxiety disorders as well. So it doesn't have to just be panic disorder, it could be a less occurrent thing with different anxiety disorders. And panic attacks affect 1 in 3 people in the whole of their lifetime. So many people have or will know what a panic attack feels like and have to go through that, but they're not regularly occurring things that they always have to worry about. Although you don't, there is, there are good remission rates. I think, um, for me, I used to have panic attacks several times a day, or at least one a day. It depended on the day. Like on Fridays, when I was in marching band, it was marching band season. I'm still in marching band, but this past year, it hasn't been so bad. I would have a rough 2 to 3 panic attacks a day on Fridays because we would have ninth period band practice. Then, um, then we would have a pep rally, an assembly after ninth period that lengthened um, that the school was the periods were shortened for, so to make time for that. And then when performing later in the evening at the actual games, um, and when we went onto the field, and then when we were off the field still playing, and everything was just rushing around so quickly, and I just felt really stressed out about playing something wrong or just everything moving so quickly. It really bothered me. But this past year, it's been a lot better, and I've also been a lot happier, even though I still have depression. It's just not as, I don't feel as sad and miserable all the time. I just have like other symptoms, but sometimes I do feel like that, but it's not as consistent. It just pops up and goes away eventually. So, yeah, panic attacks are not the most pleasant things to deal with, but they are certainly fixable, I guess you would say. They're preventable. If you talk to your doctor and therapist about these things, then they can help you out with them. You can use grounding techniques like focusing on sights, scents, smells. Wait, that's the same thing, but you get the point. Tastes, just general senses and what's going on in the moment. Then you can kind of bring yourself down and think about things, but not stress yourself out about them. So that was a video on panic attacks. Thanks for watching, guys.